All right. Good afternoon, everyone. Thank you very much for joining us on our media briefing for today on Wednesday. We're going to get started with our presenters. We'll launch into our presenters right now. We'll start with Lori Medina. She's the director of our Social Services Department. She's going to have an update on county housing efforts for our homeless population and others. Thank you, Lori. Hi.
Okay, hello, let me unmute myself. Thank you for the opportunity. And so today, what I'm really going to be talking about is our program that we've launched called Project Room Key, and it is really focused on housing vulnerable people through hotel and motels who can't safely self-isolate, who may be at high risk of contracting COVID-19 and or have COVID-19 but can't safely self-isolate because they don't have a home to do so, or the homes may be overcrowded and they can't safely return there. So, so anyway, we are working with a few hotels and motels to house people that fit that description in some of these facilities, with some services just to help maintain people's health and mental health, well-being. We are providing things like security services. We've got the access to medical and behavioral health services. We laundry services, of course, food services, making sure that people are, getting their nutrition needs met while they are being housed in these facilities. Right now, we've really started prioritizing our non-COVID-19 population who are at high risk. So maybe they're elders or they have some other kind of underlying health condition. And we are using the health department as kind of our entry system. So we are prioritizing those who've been identified most at need through a program called Whole Person Care, at least for the county's process. And they are the referral system into these hotel motel rooms. And then we are providing the placement services at the available locations that we have. I will also say that, so right now we are anticipating, right now we have about 15 people housed through that one program. We are anticipating over the next week or two that we'll probably have up to 70 people. That's what we're targeting, is to house all of those. And we also have a really great partnership with our coalition of homeless service providers, who is also housing constituents that they case manage through their system of care. Very similar, very same populations, very similar. They are just entering through a different doorway through those coalition service providers. And so we're really happy that we are working with both Elliot Robinson in his capacity as a consultant there with the coalition, and also, of course, with Roxanne Wilson, who is the executive officer for the Coalition of Homeless Service Providers. And I think that they have just as great a population that they have been a little quicker to house a lot of their constituents, but I'll let Elliot speak to the program that they're running.
Thank you, Lori, and thanks for that great segue into Elliot, who joins us. Elliot, a familiar face to most of us in the county, but now in a different role. Thanks for joining us.
Hi, everyone. Yeah, so I'm in a role kind of as a spokesman for the coalition, but also, helping out however I can, kind of particularly in this time of crisis, just for background. But the coalition, when the county asked us to kind of bring our partnership into a different level in terms of housing, we leveraged some of the work that the county had already done to get our program up. We started placing people last Friday. As of now, we have about 34 vulnerable homeless individuals housed in a motel. We expect to have about 100 placed by Friday is our goal. And that will be 72 in hotels, but also, or in kind of a centralized hotels, but we're also working with some of our rapid rehousing providers to expand their relationships throughout the county with other facilities to place another 29 families. So we're really pleased with the progress, and it's wonderful to see the relief on the faces of people who are getting housed and who were very nervous given their underlying health conditions living on the street.
Great, thank you, Elliot. And both Elliot and Lori will be with us for additional questions that I see coming in. Now we'd like to turn to Abby Taylor Silva, who joins us from Grower Shippers Association with an update on industry efforts for agricultural workers at this time.
Thank you, everyone. So a few weeks ago, a number of our members came together and really felt that there was a need to join and pool resources in order to provide housing for agricultural workers who may have been either tested positive for COVID, exposed to COVID, and needed to quarantine, or who had different signs of COVID. And generally in that case, people are taken to be tested, but there is a time when they need a place to stay. And so really it's positive or exposed and convalescing. And so what we've done is we have secured multiple properties, and we are providing full wraparound services to those who are convalescing there. And so that's going to include, similar to what was just noted, it's going to include full catering services, including plenty of fluids with each meal delivered, as well as laundry services. And also we've worked in partnership with Salinas Valley Memorial Hospital to provide daily check-ins, so both via telephone and in person, with our residents and discuss how they're feeling, as well as providing them reminders that if they have a variety of symptoms, as noted by the CDC, including like shortness of breath, persistent chest pain, and the like, when to seek emergency care. We also have a lot of communication between ourselves, SVMH, and the employer. And we couldn't be more appreciative of SVMH for all that they're doing. They're making these staff members available for check-in and providing guidance. And we've just found that to be a really critical part of our being able to ensure that people feel well taken care of and that they're getting the help they need. SVMH is also very helpful in communicating with us directly if people are in need of anything, more water, whatever it might be. So yeah, we're very, very happy to be providing this complimentary service. And it's really, the act of a number of our members who felt that it was very important that they had that available to their workforce. Thank you.
Thank you very much, Abby. And Abby will be here for questions after our other presenters. We'd like to turn to the people who are working directly with clients who may be affected by COVID-19 or concerned about it. And it's a familiar name, Moreno, for our briefings, but this is Dr. Pedro Moreno. He is a doctor in our clinic services for the county. He's also co-leading the Coalition to Protect Farm Workers in the Salinas Valley. He'll talk a little bit about that and about what he's seeing in his practice. Hi, Dr. Moreno.
Hello, good morning, and thank you very much for inviting me to be here with Elliot. I haven't seen him for a long time. And also, I'm very excited to hear what the Growers and Shippers Association is doing right now to protect farm workers. Thank you, Mrs. Taylor, for sharing this incredible program that you have developed. As I said, my name is Pedro Moreno, and sometimes they confuse me with Dr. Ed Moreno, and I have to say that I don't have to have that responsibility that he's wearing his shoulders. But I'm trying to help him and help the health department, because I've been a family physician in this county for the last 22 years. I trained at Natividad Medical Center, and then after that I joined the faculty at Natividad. Some of the babies that I delivered 26 years ago, they are now having babies themselves. So I've been working for the farm workers all my life, and I have dedicated my life to serve them. And I'm very proud and very honored to be with them, especially in this time. I am also a leader, a physician in the Monterey County clinics in the COVID-19 task force that we have in the county clinics. But first, let me tell you a little bit about our health department clinics. And we are now a group of 10 clinics, and we are in Seaside, Marina, and Salinas, and we are all under the umbrella of the health department. We serve thousands of patients. Most of them are people who are in the essential workers right now, farm workers, people who are working in the ag industry, and also in other essential professions. Many of them are just working, and some of them have insurance, some of them don't have insurance. But our county clinics, we serve everyone. It doesn't matter whether they have insurance or not. We have 350 employees approximately. This includes physicians, nurses, medical assistants, and social workers. We have psychologists, and we have even legal experts. One of them, Aaron Boyd, will be talking right after me. Our clinics are open, and they're in full service. We provide mostly telemedicine right now, but we also provide some face-to-face visits and also some urgent visits in our outside tents that we have. Most important, we have a 24/7 physician on call that will be able to answer questions to any of our patients. Unfortunately, our medical director, Dr. Caroline Kennedy, couldn't be here today, but she works very in close collaboration with physician leaders in our county hospitals, also with our health department leaders, and with the Office of Emergency Services. And she's coordinating all our medical care from our clinics, 10 clinics, with the rest of hospitals and health department. In summary, I want to make it clear. Our 10 clinics and serve the working families in Monterey County, and we will be here, and we are ready for them in this pandemic. But the question that I have is, can physicians alone defeat COVID-19 in this pandemic? And I have to be very humble. Physicians, we cannot do this alone. We need, especially now, we need all our community to protect our most vulnerable families in this pandemic. And that's what we are doing. And Abby Taylor is part of this coalition that the health department encouraged us to develop just a few weeks ago. And the same way that we have a coalition for the homeless, are vulnerable, we have a coalition right now to protect also another vulnerable population, the farm workers. Who is in this coalition? We have leader physicians from the hospitals and clinics. We have researchers from UC Berkeley, professors from CSUMB. We have, of course, health department leaders. We have legal experts, many community leaders, elected officials, and most important, we have the agriculture industry, like Mrs. Taylor and with her grower shippers. And what are we doing in this coalition? Well, we are trying to collaborate together, to communicate. We meet every week. We have working groups, and we want to make sure that we coordinate all our services to protect the farm workers in this pandemic. So I'm very proud to say that some of the accomplishments that we have so far is that we have contacted our governor and other philanthropic organizations to request face covers for our farm workers. And now we will be receiving 40,000 face covers for farm workers in the next few weeks. We have also contacted our governor and elected officials in Sacramento because we needed to increase the testing for COVID-19. As physicians, if we don't have testing, we cannot really help in this pandemic. And now, as yesterday, the states have given Monterey County 2 additional testing sites, as you know, one in East Salinas and the other one in Greenfield, that will be testing hundreds of patients, including farm workers. So the third victory that we have done is now our coalition members have partnered with the ag industry to take groups of doctors to educate farm workers in the fields. And finally, we are also developing research protocols to evaluate the rates of infection among farm workers. So we are very proud of this collaboration in our community among physicians, ag industry, researchers, health department, and community leaders. And we are convinced that together we will continue working in partnership in this pandemic. But as a physician, I had to share a story, the story that I hear over and over again. Let me tell you about Maria, a young mother working in the strawberry fields. I have to call my patients every day. And this time I call her to find out about her daughter, a 4-month-old that I've known for many, and I know this family quite well. Maria told me that when I call her, that I hear some background noise, and she was working in the field. She was picking up strawberries. And I started asking her about her daughter. She said, no, doctor, my daughter is well, but I'm a little sad. I'm a little sad because I had to leave my daughter with my babysitter, a neighbor. I had to work every day picking up strawberries. When I come home, I'm lucky that I can spend a few hours with her. And I'm worried, doctor, about this virus. Will this virus hurt my daughter? Will this virus hurt me? I don't know. Maria tells me the story of many, many farm workers that I have the privilege to serve. And she rents a room with her husband in an old apartment in East Salinas. She uses the food banks and is afraid, very, very afraid of the virus. Again, I'm privileged. Maria and my farm workers inspire me every day with the stories of courage, resilience, and strength in this pandemic. Today, I told Maria that on behalf of all physicians in the clinic, we thank her for putting food on the table. I remind her that she's not alone. We, all of us in the coalition, all of us in our community, we are going to do everything possible to support her now more than ever. And we will protect her from COVID-19. Finally, I want to thank all of you in the media that are recovering the stories of our farm workers and all of our essential workers. Remember that together in Monterey County, we will defeat COVID-19. I have no doubt.
Thank you very much, Dr. Moreno. And now we're also joining us is Aaron Voigt. He is a director of the Monterey County Medical Legal Partnership. He's also a managing attorney for California Rural Legal Assistance. He's developing educational materials and income replacement for agricultural workers, and he can share information on that. Hi, Aaron.
Hey everyone, it's a pleasure to be here with you today and very inspiring to hear the amazing work that's going on in so many different parts of the county, from both county agencies to nonprofits to the ag industry and many other folks as well. Again, my name is Aaron Voigt. I'm an attorney for California Rural Legal Assistance, Inc. We are a statewide organization and provide free legal services to rural low-income Californians. We've had an office here in Salinas for more than 50 years. Providing free legal services to Monterey County residents throughout the county. And I am the managing attorney for our medical legal partnership, which you've heard Dr. Pedro Moreno and others allude to. And that is an effort that we started in 2017 to address the social conditions that are impacting the health of low-income Monterey County residents. We, as attorneys, are on site at one of the 10 clinics that the Monterey County Health Department runs every week, providing free legal services to patients that have what we call health harming legal needs. And in the past, this might have looked like a child who has asthma that is being exacerbated by mold in the home. And whereas previously a doctor could prescribe steroids or an inhaler, it was very difficult for that doctor to address the underlying root cause of the child's health issues, which were being exacerbated by the asthma in the home. And when medical providers work alongside legal services providers, we can do more together. And what we can do is we can alert the landlord to that mold in the home and address the underlying root cause of this health condition. And now in the times of COVID-19, social determinants of health look different. They look like an undocumented Monterey County resident that isn't sure if they'll be able to get health insurance for COVID-19 related treatment. It looks like a farm worker who's worried about reporting to work because they have diabetes and they heard that somebody at their work site tested positive for COVID-19. It looks like a Monterey County tenant who can't make rent, who wasn't able to make rent on May 1st and is worried about what might happen to them. So we're adapting to a new set of social determinants of health that are impacting Monterey County residents and the over 40,000 primary care patients that attend Monterey County clinics throughout the county. So I just wanted to very briefly go over 3 specific areas where we're providing assistance to residents specifically targeted around the response to COVID-19. And one is with regard to access to healthcare. By the end of this week, we'll have a 4-minute video that addresses access to healthcare that will be available in English, Spanish, and dialects of Mixteco and Triqui. That'll be available on our crla.org website. And there are several key messages, 2 of which I just wanted to go over with folks right now. One is that all California health plans should cover the entire cost of COVID-19 treatment and testing, emergency treatment and testing, and that no COVID-19 related testing or treatment will count against somebody in public charge considerations. It won't be a negative factor in a potential immigration case, either currently or in the future. So I will refer folks to that video and we'll absolutely circulate that in the various languages when that becomes available. The second area that I wanted to address very briefly is the social determinants of health when it comes to work, and to commend the coalition that Abby and Dr. Moreno and others have been working so hard to make sure that there is an ag advisory that does give guidance to employers on how they can help make sure that their workforce stays healthy and is able to continue providing these essential services that we all depend on. And also to make sure that for workers that aren't able to continue working, either because they are sick, they have a family member who's sick, they have a child whose school is closed, or for whatever other reason, that they're able to connect to wage replacement programs and to job protected leave programs that may be able to make this time just a bit easier for them to cope with. And so we will have new materials on replacement income and job protected leave coming out by the end of the week. It'll be a chart that covers all of the replacement income programs and job protected leave programs with an overview of eligibility, as well as a decision tree that will go question by question to help frontline providers direct community members to the programs that might be the best fit for them. That will also be available on our crla.org website, and I will be sure to circulate that as soon as they're available. And the last area I want to cover, and again, thank you so much for allowing me the opportunity and taking this time to speak with you all, is housing. Because we know that due to reduced income in other situations, it is really difficult for many low-income residents to make ends meet right now, and that includes paying rent. And so we want to get the message out that most evictions are delayed right now and can't move forward unless they're necessary to protect public health and safety. So we are coming out with a housing one-pager this week that will also provide that information to tenants, as well as provide a template letter on the backside if tenants need to communicate with their landlord that they're unable to make rent. I will circulate that to those on this call, and also that will be up on our crla.org website. And lastly, I just wanted to say it's such an honor to be part of all of these efforts. I've been here in this community for about 3 years now and feel so lucky to work alongside amazing advocates and to serve an absolutely amazing, hardworking, dedicated workers and communities. And so I just want to thank everyone for everything you're all doing and say that I'm really inspired, and it motivates us to do everything that we can as well.
Thank you very much, Aaron. And we are able to have Dr. Edward Moreno on our call. He wasn't on the tentative schedule, but he is able to join us right now and give us an update on public health matters and possibly changes this week. Hi, Dr. Moreno. You'll need to unmute.
Thanks. Thank you, Maya. So, and thank you again for inviting me to the media briefing. So we're currently still in a shelter-in-place order at the local level. And as a reminder, this is one of the main ways that we slow down the spread of disease. Shelter-in-place order with cooperation from our community. It allows us to implement a variety of social distancing measures, which include staying at home unless we have to leave. And then we do go out, covering our faces and maintaining proper distance from other people. The governor has announced that he and his team are going to be easing restrictions in phase 2, and that those restrictions will be rolled out in a stepwise fashion. And so so I understand that he's looking at allowing curbside pickup and delivery for, I believe, florists and sporting goods stores, clothing stores, for example. So what I'm looking forward to is actually seeing the announcement in writing to provide more details as to what requirements the governor will make of local businesses and anyone that's planning on going to these businesses before making any decisions. I understand that these particular businesses would provide a benefit to the community and also provide some much needed work for folks living in Monterey County. So there is a economic benefit to that. And I just want to see what the governor is proposing in terms of specifics on how, what type of specifics he's including in his, I believe, formal announcement in writing later this week. So I look forward to seeing that. We continue to work on containment of the virus, in addition to our mitigation efforts, which are the social distancing efforts I just described. Our containment efforts continue to be primarily the receiving test results of people who have COVID-19, and then contacting them and working with them, and if necessary, their employers to understand and identify people that were close contacts and exposed. So we've been able to now contact every confirmed case in Monterey County or their families, and make sure that they have been isolated. We've also been able to identify over 1,300 close contacts to our cases, and that has allowed us to notify these people that they need to stay in quarantine because they could be infectious. And if they do develop symptoms, we often will recommend that they get testing. And if they don't get testing, then they're presumed to have COVID-19, and they're instructed to stay in isolation as well. So of those 1,300, we've been able to contact over 96% of people that we've identified. The small percentage that we can't contact sometimes it's due to our confirmed case not having the correct phone number or for their close contact, and so sometimes that happens. Or we get an address and the address is not the correct address, so that happens. But our team's done a really good job despite all that to achieve such a high percentage of success in contacting and then subsequently quarantining people who are infectious. So, and then in terms of guiding decisions moving forward, as I stated before, the ability to know how many people or what proportion of people in the county have COVID or been exposed to COVID-19 is very important for decision making. We have the now increased testing capacity through OptumServe, and we've been working with OptumServe and our partners to get the word out that we really need people to take advantage of this opportunity. We in particular really want local law enforcement, local first responders, and healthcare workers to sign up to be tested. So it's really important it's much better to know if a police officer or a nurse are infected and contagious than not to know. So it's better off because our first responder and our healthcare agencies are better off knowing who has it, getting them isolated so they stop spreading the virus in the workplace. And that should lead to smaller groups of confirmed cases and smaller outbreaks in those sectors. So we're very fortunate for that. We will need to look at the impact of increased testing on our total numbers, and our epidemiology team we haven't had that yet, and we will as soon as Optum gets really up and running. But they're already looking at ways to decipher what is the true trend and what part of that data represents the true trend in transmission in Monterey County, and what part of those increased numbers represent identification of patients infected due to increased testing capacity. One of the things that we definitely will continue to look at is the hospitalization rate, because people who come to, just about anyone who comes down with COVID-19 in Monterey County at some point is going to seek healthcare if they're feeling short of breath, can't catch their breath, very tired, high fevers. They most likely seek help. Many of them will seek healthcare and require hospitalization. So that's an indicator that we can, I think, really hope to rely on when we start getting the increased numbers of cases. If we get increased cases, but our hospitalization rate remains the same, then much of that increase in number of cases may be due just to increased testing. So those are some of the things that we're going to be working on as we continue to increase testing in Monterey County. And I think I'll stop there, Maya, and see if there's any questions.
There are. Thank you, Dr. Moreno. There were some questions that first came in about Dr. Moreno's plans regarding Friday and the governor's announcement. I'm going to skip over those because he addressed them and go into some of the next ones. And Dr. Moreno, you talked a little bit about the Optum Serve testing facilities. There's a question about explaining how the testing is administered in those facilities. And I don't know if they're different from any other type of testing and whether you might be able to address that.
Yeah, certainly. That's a good question. I'll point out that the test or the swab that is collected by the Optum staff at these 2 testing centers will be sent to commercial labs. They're planning on sending them to, last I heard, they're going to send them to Quest, and the results will be, and it's a swab, so it's a nasopharyngeal swab. So it's the swab that goes into the nose. So that's the type of test. And when the laboratory receives it, they're going to run the test that looks for the virus itself. So that means if you test positive, if a person tests positive, that means that person actually had virus in the nose. That's the type of person that if they cough or sneeze, the virus is going to get out into the air, and anyone that's close by when the person coughs and sneezes could be exposed to the virus. So that's really the best test that we've got right now for identifying who's infectious. And so we'll get those results, and that's because Quest is a laboratory in California, and all laboratories in California are required to report test results to the local health officer of where the person resides. So we'll get those, and we will do what we've been doing, which is identifying, talking to them and identifying who were their close contacts. Because we're going to have more positive tests, primarily at first just because of increased testing, we're going to need more people to contact these new cases, and additional staff to call all of the close contacts that we identify. So we are looking at reassigning additional staff to our team. We are also hopeful that we will be one of the counties that receives additional personnel through the state's testing, statewide testing program. And we have requested of the state to be part of one of the early counties to receive statewide training for both case investigation and contact tracing, and hopefully we'll start receiving that training as early as next week or the following week. So the training will enhance the training our staff already received from expert contact investigators here in the department. So that's a very, very needed service across the state as we bring on people into our workforce that don't have much experience prior to this with investigations and tracings, but rather than us training them, the state will train them, which saves us time. And I know some of the people that are on that statewide work group, and they're health officers, and they have a lot of experience in this. So this plan the state is putting out has had local input to make sure that the training is consistent with what we've done in the past and consistent with what we need specifically because of this virus.
Thank you, Dr. Moreno. Here's another question for you. It asks you to expand upon some information you gave earlier regarding the governor's announcements and your anticipation of additional information about something written from the governor. Could you describe or give examples of the types of businesses that you would be looking at to open or have services in some fashion in this new phase?
So right now, the only businesses that I'll be looking at are any businesses that the governor releases in writing or in a report or in an order statewide. So he's already announced it in some of his releases, but we'll see if I want to see the details that go along with that. The governor's been receiving input from the state health officer, Dr. Angel, and her deputy directors, Susan Finelli and Dr. Dean, on these matters. So, and we've had some conversations with them as well on this. So I want to see what type of additional requirements are placed. So when we, he's mentioned curbside, and I want to see what type of details there are before and then I'll look into that with my team here to see if that's something that we can, that we're ready to do in Monterey County. And if so, are we going to put additional limits if the governor doesn't have adequate requirements for our situation here in Monterey County?
Thank you, Dr. Moreno. And this question dovetails a little bit on your discussion about OptumServe and additional testing. What are the concerns with cases rising due to future testing expansion? Is that a possibility once more tests are being done for the public?
So I guess the concern I have would be from the public's perspective. I would like them to know that an increase in number of cases doesn't necessarily mean that we have an increased transmission in Monterey County. It may be due partly or mostly to the increased testing. So that's something that we'll need to analyze the best we can and communicate to the public. The other concern from where I am from public health is not ramping up, but continuing to enhance the number of people that we have working in case investigations and contact tracing. So it's been an ongoing effort. We've got, we're probably going to have, we're hoping in the next month, in the next few weeks, we'll have probably 10 times as many contact case investigators and contact tracers than we're normally staffed to do those type of activities outside of the pandemic. So we've done what we can, and we're going to continue to bring more people over, and looking forward to hopefully the state deciding that Monterey County can receive personnel that can assist us. We very much appreciate it if we get selected by the state to receive those people. So those are my concerns about increased testing.
Thank you, Dr. Moreno. I have a question for Abby. I don't see that there have been some questions and answers going on between Abby and some of our participants, but I think this one has not yet been addressed. What specific efforts are being made to reduce crowding in hotels, motels, and farm worker housing? And have companies been forced to change practices?
Sorry, I had trouble unmuting there. I think that in general, we're looking to follow the recommendations and the orders put forth by the health department and the county, just generally as it relates to social distancing and facial coverings and the like. As it relates to overcrowding, we're providing this housing specifically to address a need based upon if there are situations when someone would be going back to either H2A housing or to their home and living with roommates or their family members, and they need to instead get well somewhere else so that they don't spread the COVID virus. So, that's exactly why we're doing this. And then we're following the recommendations, we're sending those out to our members. We're providing constant updates to the advisory that we created about 4 weeks ago. That was actually just posted, and you can find that on our website, further updates at growershipper.com. So those really, the culmination of those efforts has led to both advisories that have been updated and this housing project.
Thank you, Abby. And I have a question for Elliot, and this is a follow-up question to a thread that's gone in chat. It's from the Herald. Did I misunderstand Elliot saying 34 clients were housed now and could accommodate up to 100? And this is just squaring the numbers between the coalition and social services and other agencies.
That was my answer. Is that good? Do I need to answer more? Can I just add, actually, there's another question that came in about where some numbers came from. And I just want folks to know, when we're on our EOC briefings in the morning, and the coalition does participate through Roxanne, we present our anticipated numbers, including those who we thought would arrive, but we're still trying to reach as many individuals who are homeless. They don't have a fixed address, so you have to locate them. So where there are differences, they're part of how we're communicating with the EOC on what to anticipate at location. And certainly in that environment where we're partnering, we don't want any surprises between either party. So hopefully that answers the question that I think came from Zeus Johnson.
Thank you, Elliot. And I have a question for Dr. Moreno. Oh, did somebody want to step in? No? Okay. It's for Dr. Moreno, are you looking at easing sport fishing restrictions? And let's see if he's not on the call right now, he might be able to pop back and we'll get him to answer that question. Oh, there you go. Hi, Dr. Moreno.
Hi. So, yeah, thanks. So, I get a lot of inquiries from Monterey County residents wanting to know if the certain activities are allowed or not allowed. So I have gotten the question about the sports fishing. I'm sorry, I'll just say fishing for now. And so I'm looking into that, and as the inquiries come in, work with our county team to look at the purpose of the activity. So for example, does this activity provide physical activity? Does it provide access to food or healthcare services? Just as some examples. And what is the risk to the public if we permit those activities? And then finally, look at the health officer, or the current health officer order, to see if the health officer order states that is allowable activity. So there's a process. I take it and I work closely with county council, our attorneys, to make sure that determine whether or not the health officer order as written allows certain activities. So I don't think I provided you the yes or no answer you were looking for, but I just want to let you know that we have a process, and I want to really make sure it's a thoughtful process, because anything that I limit or restrict in the health officer order needs to have justification from a public health, to protect public health while still allowing for some economic and social benefit to the community.
Thank you, Dr. Moreno. And I have a couple of questions on the same theme about whether there is a county stage 2 readiness report in the works. You mentioned what you were looking for in regards to the governor, but you may want to touch on what goes on behind the scenes to prepare for this.
Yeah, I could share a little bit. So I've, one second here, Maya. Let's see. Why don't you come back to, oh, hold on, I've got it here. So, I guess what I'll share is that the plans to reopen, or not reopen, to ease restrictions, as I mentioned, have to be balanced with balancing both the social and economic benefits of easing restrictions with public health, and I still strong believer that we need to look at both, but make sure that public health is a priority, and that we're not easing restrictions for reasons that really aren't public health reasons. So we have frequent discussions with the state health officer and my colleagues, and many of us have issued some written guidelines. Some of us have not yet, but we have quite a bit of agreement across the state. So some of the things that we need to look at is in terms of indicators of readiness to release restrictions. I've mentioned on these media briefings before, but I can try to go through some very quickly. I've already mentioned that the number of hospitalized patients needs to be, with COVID-19, needs to be stable from day to day across the county. We need to make sure that we have sufficient hospital capacity, meaning that there are enough beds that can be staffed to take on an increase of COVID patients that might follow a release of restrictions, because releasing restrictions gets more people outdoors and interacting with others, even though through social distancing, there's still a chance of exposure. Want to make sure that we have sufficient testing for the virus so that we can isolate people and also get a better idea of how prevalent COVID-19 is in Monterey County. And as I mentioned, the Optum services that are coming to Monterey County are going to help us with that. We have to have adequate capacity to do the case and contact investigations. So fortunately at this time, we've been able to keep up with those, with the number of new cases that are coming our way. And I'm hopeful that we can continue to make this part of our list of indicators a part that can be met as we move forward as well. Lastly, we still need to make sure that we have enough PPE for our hospitals, and our long-term care facilities. So as we and other counties release restrictions and more people are leaving their homes, there are increased chances that people get exposed, more people get sick, and when the numbers of cases and the rates increase in Monterey County, and then if we get an increase in number of people are going to our hospitals, or the number of people are getting infected in skilled nursing facilities as a result of easing restrictions, we need to make sure that we have enough, our healthcare facilities have enough PPE to protect our healthcare workers from getting exposed from COVID when they provide healthcare. Thanks, Maya.
All right, thank you. And another question for you. Have you seen the stroke rate in younger patients increase as other parts in the United States are reporting? Are they also being tested for COVID?
So I think what the reason where the question came from was there's reports of severe complications from COVID-19. We've got people experiencing inflammation of the arteries and vessels in different parts of the body. So we have young people having strokes that where the strokes are unusual at that age. We have people having severe blood clots in their extremities leading to amputations. And then we've got young children that the concern now is that some young children are getting their own type of inflammation of the arteries. The report of one child who tested positive who developed Kawasaki's disease, which is a disease where the arteries that provide blood flow to the heart swell up and they can rupture. There are some very unusual, not unusual, but the very concerning complications of COVID-19. I don't have data today to share with you guys about what's happening here locally. What we are trying to do is identify underlying medical conditions so we can see if there's certain populations that are increased risk for COVID infections in general. But I appreciate the question, and the one point I'll make is that people ask me why do we have social distancing? Why do we have shelter-in-place orders? It's because we still don't know how bad this virus can be. These reports, first they're anecdotal reports, meaning a group of physicians issue a report in a medical journal, or they have a news release, and then more doctors report the same thing. And slowly over time, our research community starts to develop more data to look at whether these are just by chance or whether these really are associated with COVID-19. So the concern that I and my fellow health officers have is that this virus may not be the type that where you get it and you might die, but if you survive, you can live a normal life. We have a lot of concerns that this virus is going to leave people with not really a normal life the rest of their lives. They could have chronic organ dysfunction, chronic renal dysfunction. So this is why we have this shelter in place, because we still there's a lot to learn, and we have to really pay attention to what our healthcare professionals are sharing with us with regards to complications of this very new virus.
Thank you, Dr. Moreno. And we had a question about sport fishing. Now we have one about golf, which I know you talked about.
Can I just interrupt to say I have
Sure.
to sign off to get onto a leadership council meeting? So take care.
Thank you, Elliot.
Bye-bye.
Dr. Moreno, here's a question about golf. One of the changes in the last revised shelter in place was allowing golf activity. And there are concerns that people from out of the county are coming here to play golf. Is that allowed?
So this question has come up before, and I apologize, I don't have an answer for you. Again, I've just been really trying to work on as many things as I can at the same time. So apologize, I don't have an answer for that.
All right. And then I think you may be able to answer this one. How many farm workers have tested positive for COVID?
Actually, I don't have that number either. I wasn't prepared to talk about that. I'm sorry.
I actually have it. I got the number from Christy on Monday. Okay. If it's all right, I can give that number. At the end of the day, May 3rd, 81 agricultural workers had tested positive.
All right, so thank you. So I'll just, thank you, Maya. So that is a category of occupations. And so this would be anyone that identifies as working in the ag industry. So that could be farm workers, it could be people who transport produce, product, workers, people in irrigation, it could be contractors, it can be farmers, growers, anyone that associates with the ag industry falls into that category.
Thank you. And here's a question about contact investigators. I don't know if you actually gave a number, but how many contact investigators do you have on staff right now? And I know that there are some changes coming. You'll have to unmute.
So, you know, I would have to check with Christy to see how many we have now. Sorry, I wasn't prepared to answer that question.
That's okay. And for the person who asked, I'll forward that question to them. And then I'm
I
going
guess
to,
what I can tell you is that we're planning to bring on another 10 case investigators and another 10 people to track down the close contacts.
thank you. And I'm also, just to update the number of 81 that I gave you, I have a text that our number as of the 4th of May is 87. So that brings everyone up to date with the most current numbers. So back to you, Dr. Moreno. Here's another question. Can you speak to whether or not the strain of COVID we are seeing in the county is the original strain that made its way over from Wuhan, or the new, more contagious strain the Los Angeles Times reported has been most prevalent in the country?
Hi, so that's a good question. I don't have the answer. I'd have to check with our public health laboratory director to see if she's been able to get the state to do the genomic sequencing on some of our samples, or if maybe Quest or someone's made that request for sequencing to determine which strain we have here, what's the predominant strain that we have here.
Thank you. I'm going to skip over a question about the Marina Airport hangar. I don't have anyone on the call that can speak to that, and I can get an update from our Emergency Operations Center on the status of that. So I'll go on to the next question, and this is for you, Dr. Moreno. Doesn't the county already know it has sufficient bed capacity at this point? Roughly only 36 people have been hospitalized with COVID.
Hi, so we are working with the hospitals to make sure that we can know what the maximum number of patients that we can hospitalize. And having adequate capacity in our hospitals is not a indicator that we use once to release restrictions. We're going to use that indicator over time. So this new shelter-in-place order that went into effect this week for Monterey County was based in part on the fact that we had capacity in our hospitals to take on increased number of hospitalized patients and ICU patients if, as a result of easing restrictions, we have an increase in number of people who require hospitalization for COVID-19. So we'll continue to monitor that. And then when we get to a place where we're looking at, we've had sufficient time to look at the impact of a release of restrictions on several activities. If we continue to have adequate capacity, then that would be one of the indicators that we'd use to determine whether or not we can allow more activities in Monterey County. So it's not a one-time thing. We may have capacity now, but we might not have capacity or the same amount of capacity moving forward as more people get out and expose each other to COVID-19.
Thank you. And I'm going to jump down to this one question. This person hasn't had a question read yet. Does the county have plans to conduct an audit of the shelter-in-place compliance in order to provide more accurate models than those based on an estimate of 70%?
Yes, thanks. So the efforts to determine compliance rates among Monterey County residents would be very difficult to do. So what we at this time are tracking is, as I mentioned, total cases. We're also tracking the number of hospitalizations we have over time. So those are some of our indicators that we're following. If we have an increased number of hospitalizations, the number is growing, that could be due to a variety of factors. One of them could be that people are not abiding by the shelter-in-place order. So that's something we'll have to consider. I hope that we can continue to slowly move forward with releasing restrictions a little bit at a time. And I'm hoping that the people will comply with requirements of new activities so that we continue to slow the spread of the virus in our community.
Thank you, Dr. Moreno. And I'm going to circle back to the question on the Marina hangar. We have our CAO, Charles McKee, on the call, and hopefully he can give just a brief update on that for the reporter who asked.
Thank you, May. I appreciate that. So I don't have the exact specifics on the Marina hangar and where we are with completion of the facilities out there. I know it's moving along, but I think the bigger point there is that luckily at this time we have sufficient capacity at all our hospitals, such that we don't have an urgent need to open up the Joby Aviation site at the Marina Airport, and we would only open it when if we are experiencing a need, meaning that the area hospitals are overwhelmed, and we are far from that point.
Thank you, Charles. And sorry we went over just a little bit over our hour, but I wanted to try to squeeze in one more question. Thanks very much for joining us for our media briefing today, and thank you to all of our participants who provided information. Our next briefing will be on Friday, and we'll see you then.